This week's guest on Hunger Hunt Feast was an emergency medicine trained doc who found himself getting fatter and sicker following the standard guidelines, who, after turning his health around with a new diet and lifestyle, decided to pursue preventative medicine. Join me as I talk to Dr. Shun O'Mara and his search for optimal health. Thanks for joining me today with another episode of Hunger Hunt Feast. With me is Dr. Shun O'Mara. Trained in emergency room medicine, but has shifted his focus to preventative medicine through lifestyle and a search for health optimization. Welcome, Shun. I appreciate you being here with me today.
Sure, Zane. Well, I appreciate the opportunity to join you and your audience. First, I'll just, compliment you on your work. I'm super excited to find out about you and really pleased with the opportunity to join you today and help with the discussion on how people can become more healthy.
Thank you. I appreciate it. Well, I love your shift is, away from reactionary medicine to lifestyle. Like, how can we help people take charge of their own health and prevent, start making decisions before they're diseased rather than, wait until they're so far gone they have to be meted up and they really have no control. They basically have to hand over control of their life to the healthcare system. And I love that you're going deeper and actually looking. It seems like you're going for biometrics or metrics that are not common in medicine, and but that your layman could take and use to measure their own progress or where they sit health-wise. So that's fantastic. I mean,
Yeah.
you're empowering people is what it sounds like.
Well, I borrowed the concept from the engineers. If your audience and yourself are tracking what's happening in the area of health and the space that we enjoy in social media with trying to promote health, a lot of the excitement is coming from engineers. I've both you and I have talked in the past about Ivor Cummings and root cause analysis, the engineers up in Seattle. And I think they bring an approach of analytics and quantification with a fresh new ideology that I think is going to make significant contributions to the field of health. So I think there's a real potential for disruption from the engineers, and they have a saying, if it doesn't get measured, it doesn't get fixed. And I think there's a lot of wisdom to that. But to fix something, you got to be measuring the right things. And I think in the past, and for most of my time and most of the modern day medicine, conventional healthcare, we've been measuring the right things to treat people and to have a profitable model. I mean, healthcare today is the largest part of our economy. And that's not just by coincidence, because we direct a lot of measures and efforts in that regard. And so conventional physicians are trained to measure disease and markers of disease for the purposes of treating it. But the approach I advocate and that I see being advocated now and used, really heralded by the engineers, is one to measure markers of disease for the purposes of reversing it and making it go away, to fix that problem. And throughout medicine, we just haven't had that approach to make problems go away. We mask them. We prescribe pharmaceuticals for improving symptomatology. But this is a very different approach now. And I think it's really imperative that we look at the right things to measure, to identify what they are for the purposes of making them go away and actually improving human beings through disease eradication. So I know it may seem kind of nuanced to people, but it makes all the difference in the world. In the one paradigm followed by conventional physicians, people continue to worsen. They just end up spending more and more money. In the latter, when you adopt an approach towards health optimization, tracking, identifying the right things to actually reverse disease, people actually get better. So it's a world a difference in terms of the results.
So actually achieving wellness through instead of just continuing to maintain the disease at a marginal level, actually reversing and improving wellness and through a different set of markers, basically a different paradigm is what it sounds like.
Absolutely. And I got started doing this about 10 years ago. As an emergency medicine physician, I was a passionate, very excited emergency medicine physician who just loved intervening and handling any kind of emergencies, whether it was trauma, penetrating trauma, motor vehicle accidents, gunshots, stab wounds, acute heart attacks and strokes. You know, the more of an emergency, the more excited I was about the particular case that I was handling. But it was really an encounter with a patient that stood out in his level of health and compared to a lot of other people, and in terms of, you know, his appearance and his performance. And he was sharing with me. I asked him, "How is it that you are so healthy? What are you doing that's so different?" And he, at that time, told me about the paleo diet and eating high fat, low carbohydrate, and that approach. And that seemed completely contrary to what my physician training and understanding of health at the time was, which is to basically be eating a low fat diet.
Right.
I was walking around the hospital with a gallon of skim milk with a chocolate Hershey's powder, poured it into it. And that was my idea of a healthy, healthy meal to keep myself sustained while I was seeing ER patients. And so he told me an interesting story about Sergey Brin, who was the owner and founder at that time, and elected to go paleo based on data analytics that Google was employing to track what people at that time were surfing on the internet as a measure and a metric of what's important to them. So in following diets and different strategies people were doing at that time, Jenny Craig and Weight Watchers and Nutrisystems and some of the other, you know, long players in this particular space, Google was observing that people were spending more time reading about and pursuing paleo and a high-fat, low-carbohydrate diet than the other diets. And then secondly, that more of those people were endorsing paleo to other people. In other words, their family and friends began to do the same thing. And so if you want to know what's important to somebody, basically, you know, what works in this particular case, then you look at where they spend their time and their money, and do they share it to other significant people in their lives. So if you follow, you know, paleo later developed into keto, and now a more recent manifestation as you're limiting carbs more over the ketogenic existence, as the highest zenith of a carbohydrate elimination is really a carnivore diet.
Right.
And so about 2 years ago, I started becoming carnivore. So the results I had early on with going paleo and cutting out carbohydrates, limiting carbohydrates, I should say, at that time, absolutely left me astounded, because I just did it because I thought it would be a healthy diet. I went into it without any expectation for anything other than it's, you know, might help me lose weight and then I would be more fit. Well, at the time I was struggling with terrible gastroesophageal reflux disease. I had Barrett's esophagus, precancerous lesions in my esophagus. I made terrible noises, burping, and these strange whooping noises that were a consequence of, you know, really erosion of my lower esophageal sphincter and my esophagus. I had high blood pressure. I had clogged arteries that I had measured. I was pre-diabetic. I had enlarged prostate that was waking me up 3 times a day. I had arthritic, degenerative joints that were bothering me, terrible back pain, you know, eczema all over my body. And then as I adopted a high-fat diet, cut out, you know, reduced carbohydrates, I just noticed that all went away over a slow period of time. And here I'm peeing with a bigger stream and I'm not getting up anymore. And my reflux went completely away. My blood pressure normalized. My eczema went completely away. And the only way I can describe it is I got so pissed off. I was so mad that I felt like I'd been living as a fraud as a physician, purpose to help people. And
Right.
here, nothing had worked. All the medications I was on, nothing came close to just simply eating a low carbohydrate, healthy fat diet. And I just was like a complete eye-opening experience. So from that moment on, I began to study more zealously nutrition and other factors in lifestyle, and I started to do exercise and some other things, and that led me up to eventually moving to the Minneapolis area, where I teamed up with an MD PhD researcher, and who was looking at measuring biomarkers inside the body using an MRI to track in particular visceral fat. So I went through his program, was scanned, and at the time I went through a MRI scanner, and I'll just show for the purposes of the audience so they can kind of understand. Here's a model of what I went through, a level of a scan right through basically around my belly button, and it allowed me to have this image here, and wherever you see white on this image is fat. And
Okay.
so we would change the colors to help people understand there are different types of fat. So we colored what's in the middle, visceral fat, red, to warn people that's really dangerous. And the subcutaneous fat, what people are more familiar with, the pinched your inch around your abdomen, we painted a yellow in this image. And when I went through that scanner, I was super nervous about what it was going to show. And after I was still on the table, the scanner tech came out, and he said, "You are obscenely healthy." And I had this sort of epiphany where I realized that this is what was missing in our approach to healthcare, that we didn't have something to really measure very effectively health and disease. And I've since that time been radically devoted to studying visceral fat, and importantly, how to get rid of it, and helping other people by allowing direct visualization of it using an MRI scanner. So that kind of brings me up to where I was in fat, and today. And along the way, we just continued to measure visceral fat and tried different strategies on ends of ones, different individuals, to see what was most effective between appointments, scanning somebody, bringing them back, getting their baseline initially, and then bringing them back a month or two later, sometimes even just a week later, to see what was eradicating visceral fat. So we began to learn what was most effective about visceral fat. And so we've, over the past 7-8 years working with an MRI scanner, we were able to take evidence of disease being reversed and capture it through biomarkers and take it to the National Science Foundation. We received a grant from the National Science Foundation to continue our work to reverse chronic disease for the country. But we were never really ultimately successful at identifying a commercial strategy. In other words, an approach to do this where you still make money. So we were great researchers. We know how to get rid of visceral fat, but we could never figure out how you sell that knowledge and identify an audience that really wants to be ultimately healthy. So I think now we're a little further along. It's still today. A lot of our clients that went through this study had an enormous difficulty in trying to get family members and friends to get healthy. They themselves got super healthy, but there's a personality difference between people, and some people just don't want to be healthy. And so I think it's really important that we try to get as many people to model health and make it as attractive as possible, so that kind of it trickles down from the top. So I'm really interested today in working with alphas, people that head up organizations like CEOs and C-levels from major corporations, to try to basically recruit them to understanding what optimized health is, get them performing better. And that's one of the big take-home lessons we've learned, is if you can get rid of disease, people perform better, and hope to be able to influence larger numbers of people through getting the influencers more healthy to model optimized health.
Right. Wow. That's amazing. So now how long from the time you were, just kind of give people a framework of how this diet took effect in your life personally. So you were, as you mentioned, all those symptoms, pre-diabetic, hypertensive, you had a lot of skin issues, sorry. Eczema and all that. So you had all these, reflux, and I'm thinking you were in your mid 40s at that point, mid late 40s ish.
Yeah, I was about 48 years old when I had that encounter with that patient, and I decided to go paleo, high fat, low carb, and that rationale, it just made so much sense to me how Google was approaching it and Sergey Brin, and I shared it with other friends, physician colleagues that went to medical school with me, and I just thought, oh, for sure they're going to do it, but they didn't. So
no, it's already in there. So how was your health transformation? What was that? What that looked like? Was that like a number of months? Was it years? When did you really see like, I've completely changed my personal level of health? Because that must have been a big like aha moment where you suddenly these symptoms are gone and your numbers look better. What did that?
Yeah, so it was pretty slow initially. Like I just remember an aha moment peeing where, I no longer was dribbling. I mean, I have to share that if you have an audience that are in their 40s and their 50s, when you get an enlarged prostate, it's bad, you're not really peeing like you used to. I would better describe it in my case as falling out of my body. So it would kind of stop and start and dribble out. There was no, strong stream anymore. Right. And then you'd walk away and you'd have to go back and pee again. It was just hesitancy that, would start and stop. And I remember hearing that in my father. And when I was 18 and 16 years old as a young man, and he was in his late 40s at the time. And I used to think, what is wrong with him? Listening to that, it sounded awful. Right. And sure enough, that was my fate. And it was really from processed foods and carbohydrates. And that symptom, Zane, probably was one of the first ones to improve. Within just a few months, my urine stream became stronger, and I was no longer waking up on the middle of the night to pee 3 times a night. And that alone made it worthwhile to do it. Yeah.
That's life-changing.
Yeah.
I mean, getting better sleep is life-changing, but to know that your prostate isn't swelling and basically becoming diseased, like knowing what you know as a MD, you knew where that was headed.
Oh, yeah. And you can hear, even if you're young, if you go to a sports stadium, you already intuitively, if you're 20 years old, don't get behind an old guy who's got to pee, because they're in there a long time peeing. And you may go into a public bathroom and you can hear the sound of a weak urine stream, and it's stopping and starting. And there's an older guy in there that's suffering from that kind of disease. And now I'm proud of the fact I'll go into a bathroom and I just let it go. I just pee like Niagara Falls.
Show it off, huh?
I do. I mean, it's just because, you have to have experienced the frustrations and just the terrible existence it is to be able to pee. And, with it also comes erectile dysfunction and lack of just overall health throughout your body. And so I began to re-experience a new life at the age of 48 when those symptoms began to reverse. And within probably a 1 year point, every condition, certainly by 1 year, every condition that I previously had was gone. I just did not have any more of those symptoms. And followed by just an enormous improvement in how I felt, no longer taking naps, no longer falling asleep, with the crazy meals I was eating with lots of pasta and, bread and carbohydrate rich meals. But, and then, it continued to improve. And eventually, after probably, 4 years of steady improvement from a diet and adopting high intensity exercise, sprinting and lifting weights, I began to form this concept and understanding of health optimization. And then I began to explore, ask the questions, what would it look like if we took a more directed approach to figuring out, excuse me, what would Homo sapiens look like if we really put efforts into trying to optimize them through biological optimization? So that's where I started to look at many other strategies. And while many of my colleagues are doing fantastic and important work, on keto and carnivore and weightlifting and walking and standing up more, I grasped that basically we have a absolute necessity to combine all these things and
Sure.
not just talk about just doing one thing, but to bring them all together because they work, they belong together. And what it amounts to is an improved way of living. And I call it amplification. So when you take these results, a number of strategies, and you combine them together, and I use the example as a kind of a good illustration of the concept, is a prism. If you take, all the colors of the rainbow, and you put them reverse them through a prism, it comes out as pure white light. So it kind of introduces, I think, nicely the concept of there are many things that come together to form perfection. And we haven't quite seen perfection, but the perfection we're aiming for is, the optimization of human beings. And, some people might think that this is like obsession or something, but it's not. What it really is an appreciation for the more you do, the better off your life is. So if you really understand that, I don't feel like I'm obsessed. The person who's obsessed is somebody who can't stop eating cookies, can't stop eating pizza.
Right.
My life is so much better. I have no interest in those kind of things. I mean, I'm an enlightened, empowered human being. No, I don't eat cookies, and I don't eat processed foods. I eat steak and I eat fermented vegetables. I look forward to those meals as much as any time in my life. But the quality, the back end of my life is every year, every month, I get better.
Right. Right. Well, I mean, you have the counter to the counter of the poor health to compare it to, and I mean, what you're moving away from, and the fact that you're 10 years later so much healthier than you were before, and as an MD, I think that speaks volumes in what you're doing, what you're saying, and that you had all the training and you had all the direction in the conventional, not just medicine, but in conventional nutrition. And then as you've made this switch, it has made a complete switch in your health for the better. And you're in a new decade and you're better than before. That's not typical. That's not a typical result for most people as they age from 40s to 50s to improve, for their health to get better and have fewer symptoms and have fewer medications required. So I definitely think you're a living, breathing example of what you're saying from both, not just someone who's been perpetually healthy since your 20s, but someone who really had a transformation.
Yeah, well, I find it remarkable that a lot of young people can't imagine themselves becoming diseased. Maybe they kind of the notion of getting older,
They're
but
bulletproof.
it's just disease. I mean, aging is just a manifestation of disease.
Yeah.
Aging without disease is just you're getting older with more years, but you should be getting better. And I like to say that, professional athletes in the future playing in the NFL and the NBA are going to be guys in their 40s and 50s with gray hair, because they'll be optimally healthy with decades of experience playing the game.
Right.
The majority of the players today eat like Hades. They eat whatever they want, and that's why they age. They know how to play the game. They just can't perform it because they're not healthy. So looking at people that are endeavoring now to live a more healthy lifestyle within professional sports. Tom Brady is a good example of that. That's how he's the longevity of his program. But
Right.
too many young people don't pay attention to that. So here's a good illustration, hopefully,
Yeah.
that you can see. And in this image here on my left, where I'm pointing right here, you can see a profile of myself. And this particular image was me at the age of about 50, 53, 54. And I'm not terribly attractive in that particular look. My wife says, never show anybody that picture. So one of the interesting things is my stomach is pushing out in the anterior direction here, protruding. And that really is a marker of disease called sarcopenia. So your tonicity of your muscle tones are so declined in disease that they can't even hold in your enteric and content, your gastrointestinal content. And so you can see guys that are in their 50s, even in their 40s, they get these little bulges that start developing. And if you go down on your hands and knees and let your stomach hang down, the belly just hangs down, versus a nice tight flat abdomen in an 18, 20-year-old youthful man or woman, young guy or girl, because that tonicity holds that stuff in. And then 3 years later, from my efforts to optimize myself, you can see that my abdomen cleared up, it got tightened, the tone of my muscles improved. I actually developed more hair on my abdomen compared to this picture.
Wow.
And you can see that my veins have become more enhanced. My arteries became visible, the pulses on my arteries. And I don't know how it happened, but the shape of my head actually improved. It's not just a kind of a position of my head being more upright, but just the overall appearance. And somebody wants to look at this a little bit better than what is probably being represented here through our video teleconference here. You can go to my website and I have this picture. But I tell soldiers and young people who look at that, they think it's just how I'm standing. And I'm like, no, you're going to look like that when you're older too. That's from disease. But if you purpose to optimize your health and eliminate things that are destroying your body and incorporate things that are improve your body, you'll look even better than I do at my age today of 57.
Wow, that's amazing. No, I know and that's also a visible sign of the visceral fat, which you're talking about, as you showed in the scan earlier, trim down. I believe you've also you've mentioned in some of your work improvements in atherosclerotic plaques and cerebral artery as well, which of course is a big topic today, where people can survive heart disease and cancer, and then they get a little farther down the road and they start having problems with memory and dementia. And
yeah,
so
I can show you an image of that. But so this is a really bad case of a lot of atherosclerotic cardiovascular diseases. Visceral fat. This is not too uncommon from a lot of my CEOs of companies will come in with a huge amount of visceral fat in them. And as they started to have this visceral fat eliminated, they reported that they started to think better. Their cognitive capabilities improved, their memories improved, and they began to ask the question of us, what is it about eliminating visceral fat that seems to be making me smarter and better and with my intellectual capabilities? So we started to scan the brain to take a look and see what was going on. And this is a MRI image going through the cerebral arteries, or arteries, the arterial system within the brain. And in this particular side, you can see right in this vessel here, it's nice and dark all the way till it gets right about here. This area here, it gets a little more hazy. And if you go on this other side, it's dark all the way until right here, it's completely opacified from a lack of blood flow. It's very, very dramatically reduced blood flow in this individual. So we gave this person 25 things to work on to optimize their health. And they came back in 9 months. And that middle cerebral artery opened up. And this one completely opened up as well. So
wow.
this is one of our best examples of how we're able to reverse atherosclerotic cardiovascular disease by doing strategies that are going to go well beyond just nutrition and exercise, but basically making the nice, important choices to improve your life, not having to take medications or doing anything that requires a prescription. It's all stuff you can do on your own. We don't sell anything. We just tell people what to do. And that dramatically allowed that resolution, that artery. And then as those arteries open up, the arteries throughout the whole body open up. And as we were doing that for people, and of course I have to practice what I preach. I'm, trailblazing this and pioneering my own. I noticed my arteries began to open up in my arm. You could begin to see my arteries pulsating, and in my wrists, my radial arteries, my brachial arteries, my arteries in my legs, my posterior tibialis, my dorsalis pedis, arteries within the feet. These all slowly started to become stronger. You could feel them better, and eventually you could see them stronger. And now I walk around with majority of the day with completely visible pulses.
Wow.
And it's extremely rare to see a 57-year-old with visible pulses. But I believe it's a frontier. The new, it's a manifestation, is one example of biomarkers that healthcare needs to start paying attention to, rather than cholesterol, so that we can show our patients and people, consumers, what really optimizes their health. And that's a big one, is improved blood flow.
Wow. So through the protocols that you said beyond just nutrition and exercise, but through these protocols, you're improving perfusion, vascular, so cardiac output, and just general health in the vascular system throughout the entire body.
Perfusion is just the ability to push blood into tissues. And so it would stand to reason that you would see these pulses becoming visible. And it's not just, atherosclerotic cardiovascular disease, the schmutz in the pipe, I call it,
right,
that's being eliminated. But literally the walls of the arteries are becoming less hardened. So arterial hardness and stiffness of arteries, where they behave more like PVC piping instead of a nice like fire hose, where you see a fire hose being charged and you see that water flowing through, the hose rapidly. Right. You're not going to see that in PVC pipe, these hard arteries, but you want nice, soft, resistant or resilient arteries that improve with blood flow. So that I think is a very important concept to help patients be acquainted with. And one of the big changes besides the profile is when you improve your blood flow and you reduce visceral fat in your body, your appearance changes. So this is a picture of me when I started becoming healthy about 10 years ago. And this was me with all my visceral fat and all my inability to pee normally, my high blood pressure, my eczema. I had a very inflamed looking face.
Yeah.
And a lot of people think that I weighed more, that I was chubbier here, but this photograph, I actually weighed less than I do today.
Oh,
so
wow.
The changes in my face really are a consequence of eliminating visceral fat and optimizing my health. So I now look to people's faces, and I can begin to assess just how much visceral fat they have just by looking at their face. And after scanning, we've scanned over 4,000 patients. We've got a lot of experience measuring visceral fat. And over the time period of using an MRI scanner, 7 to 8 years, I detected these changes in people's faces, and they're mapping it to their MRI scan of their visceral fat. And so now I walk down Mall of America and I'm doing visceral fat analysis as people walking by, just looking at their faces. I can form an assessment of how much visceral fat and inflammation they have.
Wow. And that MRI is going to give you a lot more information than, say, a simple DEXA scan or something like that. I mean, it's going to actually shows you where this where the fat is located. Is that correct? Is that what's so distinguishing
Yeah.
about an
So
MRI?
a big difference, and I like the DEXA scan from the standpoint that it's more affordable. You can get a DEXA scan for about $100,
Mm-hmm.
but I prefer to have a MRI scanner, which gives you, a much better view, a cross-sectional view, and you can really see how much visceral fat you have in an individual. So this person here had very little subcutaneous fat, the little white on the periphery.
Right.
It's kind of an interesting story. This particular person walked into my practice thinking they were pretty healthy. They were, an owner, CEO of a company,
Oh.
and great spirits, and just could barely pinch anything. And they thought they were going to look really good on their scan. But when I showed them what good scans look like, and then I showed them what their scan looks like, I was talking to them about what they needed to do to improve it. And that person first turned absolutely green, like they were like a little kid smoking a cigar. And then they turned gray over the course of about 5 seconds. And then the next look, within 2 seconds after that, they turned completely pale and white. And I knew that look. That was a pre-syncopal stage from a lack of perfusion to the cerebral cortex, and they were about to go unconscious. And I could not get to them fast enough. They passed out, hit the floor, and I was terrified that they were having a heart attack because they had a big inflamed face and lots of visceral fat in them. But they did not have a heart attack. They just were overwhelmed at the emotional awareness that they had deceived themselves into thinking they were healthy. Because visceral fat hides out in you. You don't know unless you get a scan and get it measured how much visceral fat you have in there. So I like to tell that story to let people know that, the better imagery you get, the better impact you get from taking a look at that. And we're, hunters and gatherers. We hunt and we gather and we form decisions, not by numbers as much as our senses. If you really want to be moved, it's through vision, taste, smell, hearing, and the analysis that take place in your brain using those senses. So that MRI scanner is better than coming up with a DEXA scan, which may give you a number, or bioimpedance analysis, BIA, which is a popular one, just gives you a number. DEXA can give you a longitudinal view, but you can't really get a good sense visually how much you have in there. Ultrasound is kind of the same way too. It gives you kind of a numeric finding, but the MRI really gives you a good look, exposes just how much of the enemy hanging out inside your abdomen is in there and causing you untold chronic disease and declining appearance and declining performance in your life.
Wow. That's great. That's amazing. Yes. And it's really not used for that very much in conventional medicine. I mean, how many people have they been under MRI? It's usually there's something they're looking for, a disease, or they're looking for, a break of some form of structural problem, but not many have had the pleasure of having their visceral fat analyzed and informed of what that is, the state of it, and then the importance of it. I mean, that is the hormonally charged fat, as opposed to the subcutaneous fat, which almost is more aesthetic than anything. That visceral fat is where we really start having the health problems with our organs. Am I correct in that, with the liver?
Oh, no, absolutely right.
Heart?
And you can see it in CT scans. I don't think they're, you can get good resolution of visceral fat on a CT scan of the abdomen, but it uses radiation. And you can just jump on the internet. If you're listening to this podcast, jump on the internet and look at CTs, abdominal CTs, image CT, abdomen, MRI, abdomen, image, and take a look, and you'll see all this visceral fat. They'll point at all the anatomy. They'll point to the pancreas, the gallbladder, the appendix, the mesenteric arteries and veins, and aorta, and vena cava. They'll have all the pointers. They never even point to visceral fat. I'm like, holy cow, this is the problem. We're teaching doctors to look at everything but what really could make a difference, and they don't even comment on it. It's extraordinary. So
they don't know how to treat it. They don't have a treatment. They don't have a drug for visceral fat. There's no drug for fatty liver.
Yeah.
There's no drug for a fatty pancreas.
Can't
Yeah.
make any money off of it, so they just don't go there.
How do you write a
And,
prescription for fasting? I
yeah.
mean,
Or, if you're listening to this, go have fun with your doctor. Make him or her sweat and say, doctor, could you tell me, I know visceral fat is really bad. How do I get rid of mine? I mean, they just don't know. They don't care. So,
well, they don't know how to get rid of their own.
yeah, they don't. Yeah. I mean, they look really bad. And, most of them, particularly, they might look good. I looked good when I was a brand new doctor, but as you age and you accumulate that visceral fat, and by the way, if you're, a young lady or a young man and you're trying to, you're looking to get married and you're trying to find an attractive mate, get rid of that visceral fat and you're going to look much better and be more attractive to people. But with regard to healthcare providers, I think it's really important that physicians look and look the part instead of just talking it. They have to improve their appearance, because why are we going to listen to somebody that looks so bad and performs so poorly, even if they know a lot of knowledge?
Right.
They'd be a lot more effective. So kudos to you. You look fantastic. You do not have a lot of visceral fat. Your face portrays a low amount of visceral fat. And I think that's why you're an effective influencer on social media, and that you have a following, because you look good and you perform well. And I think that's what we need. If we're going to take chronic disease and make it go away and no longer have healthcare to be the largest part of our economy, we got to eradicate chronic disease. And that's going to happen when we teach our physicians and providers across the country how to get rid of chronic disease, to starting with visceral fat. And then you're going to see, I think, eventually a tremendous reduction in the amount of disease and prescriptions. The last people that are going to get behind this are the big pharma, the pharmaceutical companies, and even conventional healthcare, insurance companies who pay these bills. They love you diseased, and they love those bills that come in. You know why? Because they take them and hold them up and say, this is why you pay so much for your insurance, because we pay this much to take care of you. And they just write that. That's just like a higher price on a house when you're selling real estate. Sure. The realtor is making more money. So the more disease, the more the healthcare system claps and rejoices in it. So we have got to get smart. If there's any politician listening to this today, you must figure out how we get this country more healthy, to reduce the greatest expense we have by far. I'm a physician today. I've got my gown on because I'm taking care of COVID patients up here for the Army. But we have got to figure out how we reduce the amount of chronic disease so we can save that money, because that's our biggest expense across the board, way bigger than defense, way bigger than anything else. And at least with defense, you end up with some tanks and some, something to show for it. But with chronic disease, you're just developing disease and you're treating it and you're making money off of it, but there's no redeemable value about it, because you're just creating a bad thing and you're putting Band-Aids on it. So we've got to change our approach to have a true paradigm, transformational change when it comes to healthcare.
Absolutely. If you, I know I don't want to hold you up, but if you could give us, just to give our listeners some action steps. And, obviously you have not all 25, but if you could just pick your top 5 or top 10 where you would say, this is what you want to implement in your life. What kind of lifestyle changes could they make to start reducing visceral fat, see that improved blood flow and these health improvements that you're talking about?
So one of them right away, to give your listeners a really good example of a super important strategy, are these scans here. Are a series of 6 MRI scans in the same individual, a 68-year-old guy. And what this individual did, he came in with a large amount of visceral fat in this first image here. And it was actually measured at about 5.5 pounds. And then in the second image, you can see that there's less redness in the middle, and his width of his abdomen is smaller. You don't have to go to medical school to see that. He reduced his visceral fat and it became smaller. But look at the dramatic change from here to this image here.
Oh, right.
And so that is over 35 weeks. And the only intervention he did in this particular study was simply eliminated processed carbohydrates. So he just cut out processed foods from his diet. He did not exercise 1 minute.
Wow.
So look at that, get your head around the fact that the first recommendation that you must do is stop eating processed foods, and you'll substantially reduce your visceral fat. The second thing I would advocate doing is not only eliminating visceral fat, but we see in our studies and working with patients, the more they eliminate carbohydrates, the faster that visceral fat goes away and the more dramatic their improvement in health. So carbohydrate elimination by adopting more of a lower carb diet through a ketogenic diet, keto diet.
Mm-hmm.
And I would advocate giving a trial of carnivore for at least 2 or 3 months to see if that doesn't give you some benefit. And I also think you need to give your gut some rest from all the vegetables and what comes in with it, lectins and phthalates and saponins and some other things that we're learning about, in regard to plant defenses. So
right.
consider, ketogenic carnivore diet, and then fasting. We just eat too much. So you should incorporate a practice of increasing the amount of time you go without eating. And a lot of my clients eventually become OMAD, eating 1 meal a day, and then doing some extended fasting as much as 48 hours in a row, 0 calories for 2 days. Ideally, I like to get them to do that once a week, and every other weekend to do 72 hours. But you got to start slow and work your way up to it, because if you have lived all your life on carbohydrates and you try to jump to a 72-hour fast, you're going to say that guy was an idiot that told me to do this. So you start slow and build your way up to it. And then I would recommend you do lots of movement. Stop sitting, get your butt out of that chair, stand up, and you'll dramatically reduce the amount of sedentary lifestyle that you have just by standing up. Do lots of walking. And then I recommend integrating and adopting a strategy of exercising less, but exercising far more intensely. So I get all my clients, I recommend stop jogging, stop running. I recommend that they do high intensity sprinting. And as a result, when I get them to stop running and I get them to sprint, they get far better results than if they keep running and add in sprinting. So there probably is increased reactive oxygen species are responsible for, the more cardio you do, the higher levels of ROS, these reactive oxygen species that are created to do a high intensity exercise. And then I incorporate as many natural strategies as possible, getting outdoors, breathing fresh air, clean fresh air, getting sunshine on your body, and allowing natural synthesis of vitamin D. And the other really cool thing is now, because I can see my pulses are visible. Here's one, I have never met another human being in the entire world that has ever reported this. I go out in the sunshine and my pulses become dramatically enlarged.
Huh.
That's because I can visibly see now the influence of nitric oxide coming from that sunshine, acting on my endothelial cells, creating the improvement in vasodilation of those vessels. And so I look at that and I'm like, that is awesome. So I know sunshine is good. The vast majority of people go outside, they don't see, because they can't see their arteries, they don't detect the increase in nitric oxide, but we are meant to be outdoors. So you thrive when you get natural sunshine on you. And so I get people out there and I get them concentrating. The other last point I'll make, I get them concentrating on optimizing their microbiome. And we could do, probably every day we could do a show on the microbiome for a year and still have material to talk about. But suffice it to say, the number one thing I tell people when it comes to the microbiome, and I think in the future it is going to be the report card on how well you're living your life and how healthy you are, is basically the species of microbes that you have inside your gastrointestinal tract and on your skin. And the thing we have got to stop doing is harming it. And we do that through a variety of influences, mostly with the GI tract, and taking chlorinated water and fluoridated water and chemicals that get incorporated, food preservatives from processed foods that are purposely added to food to keep it from going stale and rancid by suppressing the action of bacteria so that it tastes fresh. Well, those go down and disrupt and destroy our very delicate organisms that we share our lives with. I mean, we're really basically more of an ecosystem than we are one single organism. So microbiome optimization. So fall in love with the concept of the microbiome, high intensity exercise, visceral fat reduction, doing a ketogenic diet and fasting, and you'll see dramatic improvement in your face, your appearance, and your performance.
That's awesome. That's awesome. That's wow. I appreciate that, because I've told people that as well for the same thing for a couple of years. But that is part of the philosophy of just hunger, hunt, feast, with fasting, movement, and then great food. So I mean, that's awesome. Great advice that anyone can implement right away, and they don't have to go out and purchase anything special other than just make better choices in the grocery store and get out of their chair. That's awesome. Fantastic. Thank you so much. I want to make sure I link to those slides you showed. So wherever those are, I want to make sure I get those from you at some point, and we can link to them in the show notes, because those are for people who are just listening, be able to see those, because I think those are a dramatic example of what we're talking about here with the visceral fat. But where can people find you on social media? Where's the best place to
So I like to hang out, and I do postings about once every 3 or 4 days on Instagram at Dr. Sean O'Mara, at DrSeanomara, on Twitter and Instagram, the same handle.
All right.
And you can also find me on my website at Medcon Wellness, which is MEDCONWELLNESS.com. I love working with anybody who wants to get healthy. The clients, people that like me the most, are ones that are absolutely motivated to optimize their performance and optimize their health. They eat it all up. Other people are like, I don't know if I'm ready to try that. I'll work with you, but you may not get as much value out of working with me. You may want to get started with somebody else a little slower. I'm sort of like, I tell people, I'm like the professional basketball coach. When you walk in, you better have an attitude, that you want to get healthy, if you want to, get more for your value and working with me. But I just love helping people get healthy. I'm really looking for those alphas out there, high performers, to get them even more optimally healthy, to try to get them to role model and be evangelists for other people to get them out there at high performance. So yeah, super exciting space. I think I love what you're doing, trying to get people more healthy and showing the value. I think it's disruptive. It's transformational. The following you get and the benefit your listeners have from following you, Zane, are far exceeding what they've gotten from other physicians in the conventional healthcare system. So I just really appreciate the opportunity to be here with you and your audience. And I hope that you keep up the great work that you're doing.
Thank you. I appreciate that. And I do appreciate your time as well as an MD who, again, I said it earlier, you made a transition from reactive healthcare to really changing people's lives, prevent it from a preventative point of view, and not just to a norm, but to a greater level of excellence in their health, which is going to serve them the rest of their life. So thank you again. And I hope maybe I'll have you back in the future just to, we can dig deeper and see what you're doing then. But I appreciate your time, and I'll make sure we link to your social media in the show notes and get those scans up so people can see it. Thanks again, and have a great week, Sean.
Okay, great. Thanks, Dean. You too.